All right, thanks, Chase. Well, today we've got our experts in the house here to answer questions about pregnancy and the life of a new mother.
It's a little hairy at times. We've got Tatha Enns with us. She's a lactation consultant and a nurse at McCady Hospital, and we're talking about the importance of breastfeeding. Thanks so much for coming in.
Thank you.
I know with my babies, even my second one, you think you've got it down. I actually had to go to a lactation consultant because sometimes it's just not working right, but it's worth it, right? Why is it so worth it?
Absolutely, it's worth it. I think the first 2 weeks can be rather challenging. After that, it smooths out a lot. All of the Intermountain hospitals do offer board-certified lactation consultants to help with these issues that pop up in the first days especially. But the first days are some of the most important times when the baby gets that early colostrum that has all of the antibodies in it that help the baby's health.
The liquid gold.
Yeah,
Yes.
so that's the stuff that passes on everything that the mother has developed an immunity to the baby, is that correct?
Absolutely. It's one time in life that you have colostrum is those first few days, and the benefits to the baby are very great. It actually can help the inside of the gastrointestinal tract to grow little villi that will help the baby absorb nutrients for life.
Wow.
So this could give them a healthy start to life in general just by getting that first couple days of breast milk.
It does.
Okay.
And we're talking about brain development, and what else is in a mother's milk that just can't be replaced by anything else?
There are growth factors. There are antibodies that help protect against infection. A baby that is breastfed has a lower chance of getting things like gastrointestinal diseases, even childhood cancers. It can help be protective against diabetes, type 1 and type 2. So there are a lot of health benefits long-term that come to the infant that is, gets their mother's milk.
A lot of times I think we think milk is milk, but what's the difference between human milk and then cow milk? Because obviously you don't want to be giving cow milk to your infant.
So sometimes, cow's milk is important because not every mother can breastfeed, and we need to make sure we understand that. But ideally, infants should receive human milk. Human milk is meant to grow an infant's brain, whereas cow's milk is meant to grow a big fat cow. So sometimes you have a higher risk of obesity when, human milk is protective against that. So
if you have an infant or a baby, and it happens sometimes that mothers just cannot breastfeed their baby, what do you guys suggest for a mother that can't do it? I mean, there's formula, you can go to a donor. What would you suggest?
Yeah, we actually hope that all infants will be able to at least receive their mother's colostrum, even if she chooses not to breastfeed, because those factors in there are important for the baby. For instance, in our newborn intensive care unit, even mothers that choose not to breastfeed, we use human milk for them because it does decrease the problems such as necrotizing enterocolitis and things for a preterm newborn. But sometimes it's not possible, for a baby to receive their own mother's milk. But there are, milk banks and things like that. But generally, most people can't or don't use banked milk.
But you can help moms at the hospital pump or do whatever they need to make sure their babies get the best start.
Absolutely.
Perfect. Thanks so much for coming in.
Well, the fine folks from Intermountain are standing by right now in our 2 News lobby here in the Wells Fargo building. They will answer your calls about pregnancy, about being a mother, your health-related questions right now. Call that number, 877-908-0687.
Ask for Nurse Danny. She knows everything. She's in the front row there.